welcome to our podcast. This is Stewart Gandolf, and today I'm pleased to welcome Neil Walker. Neil is VP of Growth for Oar Health, and I recently met Neil through my travels out in the world. And anyway, I'm excited about we're working with you, Neil. Neil, welcome.
Thank you. Thanks so much for having me.
Great. So Neil, I would like to, for our listeners' sake, tell them a little bit about yourself, your background, and what you're doing at Oar Health. I think that'll be a helpful place for us to start.
Great. Yeah. So I lead growth at Oar Health, which essentially means encouraging more and more people to seek the help that we offer. I've lifelong career in marketing. The last 5 or 6 years, though, I've really been dedicated to stigmatized healthcare. So hearing loss, erectile dysfunction, premature ejaculation, weight loss, and now alcohol use disorder. That's what Oar specializes in, and that's helping people with alcohol use disorder to either drink less or to quit altogether. And we do that by the telehealth mechanism of providing prescription medication that is 30 years proven at helping people to control their cravings. And if they do have a drink, making sure that one drink doesn't become two, doesn't become five, doesn't become 10.
Yep, and I'm excited about this topic. And yes, the this has been around a long time, and most people don't know about it. So it's an interesting marketing challenge. And on the one hand, almost nobody knows about it, which seems like a total bummer. On the other hand, wow, what potential, right? So we'll dive into that in just a moment. So this field of telehealth has been really booming since COVID, obviously, and it's funny how it's shaken out. It was pretty. I remember during this process that the health systems and people that knew had been talking about telehealth for years, and it went to maybe 1% to 2% penetration, right?
Mm.
And within, weeks they had 30, 40, 50, 60%. And during that period, it was pretty clear the rubber band would snap back. Nobody's going to go see surgeons, to get a surgery through telehealth, but certainly the idea of it, the appeal of it was big. Um, Different fields have really embraced it. Others have snapped back, and we see a lot of specialized applications, like, for example, rural healthcare. Mental health is a big one. And it's become part of routine care. I live here in Orange County, California, and both my wife have doctors that we see physically, but a lot of times they say, "Would you like to do a telehealth instead?" And like, yeah, instead of driving down. So that's all good and fine. And I haven't looked at the stats lately, but it varies a lot by specialty in terms of, I mean, psych and mental health is hugely telehealth these days. But even primary care is, I don't know, 20, 30% probably. It's not as big as it was, but maybe it's 10%. I don't know. But it's definitely smaller, but it's still substantial. But what we're talking about today is pure play businesses that really are going after very specific niches. And I love that. When we talk about marketing, uh, people always think about the promotion side, but it's really about the product, right? Product, place, price, promotion. Remember that from undergrad. And so the specialized care is these companies like Oar Health are going after very specific niches. So, like, let's talk just a little bit more about Oar, and we'll go much deeper in just a moment. But, what makes it special? What makes it stand out? Let's drill down a little bit more about it.
Sure. Well, I think going back to your point about the growth of telemedicine, a big driver of that, certainly when it comes to my experience, has been treatments and conditions that have heavy stigma.
Yep.
So, um, anything where you might not want to talk to another person face to face, or maybe more importantly, you don't want to stand in the pharmacy line and have them call out your name. Anything where we can, in our, socks at home on the couch, maybe with your phone or laptop, get the help you need without having to sort of go out into the world. So that's a trend that is, definitely grew during COVID, but it's, greater than that change. So that's definitely the sort of through current for my career, and it's certainly the important part of all. Um, I think when it comes to the stigma, there's the stigma on the condition side itself. So erectile dysfunction, premature ejaculation, alcohol use disorder, all stigmatized. But then in some cases, also there's also stigma on the treatment itself. When GLP-1s came along, they were very stigmatized and frankly, still to some degree continue to be. That's true for Aura as well. The medication that we offer is frowned upon by some. There's a lot of myths about alcohol use disorder. There's a myth that you have to be at rock bottom, you have to be a full-blown alcoholic, some people would term it, before you can seek help. Others would say there's only one way to solve this problem, and that's abstinence. Others would say there's only one way to solve the problem, and that's going to a meeting in AA. And so we're here offering a telehealth solution that says none of those things are true. You don't have to hit rock bottom. That's not a requirement. You can choose moderation as a goal if that suits your needs. We believe in harm reduction, and you don't just have to go to meetings. You can do that, but you can also do medication. You can do therapy. You can combine those things and stack them. Evidence-based solutions tend to be complementary, certainly in this space.
So I think that's really important, and I love that insight. It's interesting because I have in my family history. I'll be really open, honest. I have nothing to be ashamed of here. There's some people in my family that truly had struggles with alcohol. They were alcoholics, and it was, not a good part of their life on my family tree, not immediate family, but in my family. And I saw the devastating effects of that. And for me, it's like I enjoy having occasional drinks, right? And I think a lot of people, I'm your target audience, right? Where it's like, okay, COVID, we're drinking too much. Not we don't like being out of control. And so the idea of something that I don't really label myself as an alcoholic if I'm a user. That doesn't apply to me, but I don't want to ever be in a position where I am one or where I can never, I was laughing with my wife. We went on a wine tasting trip recently. It's like, man, if I know that how I can see how people when they retire can fall into alcohol. Some of them actually become alcoholics at that point because they have so much time to kill. And it's like that would really be bad. So a product like yours is really helpful, right? For people to stay on the right side of the guardrails, so to speak. And I think those myths are really prevalent. And I'm going to ask you a bunch of questions, Mom, but I just can't help myself here. Neil,
Totally, yeah.
the parallel with GLP-1. So my wife is open about this. She won't kick me for sharing this with our audience here. She's only about, I think she was probably 20 pounds beyond where she wanted to be. And all of her friends are much heavier. And they're like, why would you even consider this? In fact, she thought she couldn't be accessed because she was too thin. And anyway, so she was literally crying at her family doctor's office, and she's like, you can't do this. And she's like, what? What? And so, but the stigma is amazing. So she's becoming kind of a spokesperson among her friends. Because of that, it's just like, I have nothing to be ashamed of, but a lot of people do, and there's still stigma around each of these categories. And, I've worked in all these categories professionally, and it's a big deal. So anyway, congratulations to you and Oar Health. I think it's really important to help people know about this. So, um, uh, why it's naltrexone is the drug that you guys are using, correct?
The medication that we prescribe currently is naltrexone. There are others out there. This is the one that we favor as sort of the frontline medication. It's the most proven and effective from our point of view. But we are not 100% wedded to just naltrexone. If
I
other
get it.
medications come along, we would supply those as
I
well.
get it. Okay. So, but the reason I was asking is it's been around a long time, right? And
Yeah.
do you have any idea why it's been so long? Is it because of competing interests in the medical space or in the addiction space? Although certainly in healthcare is known to move glacially many times. Do you have any insights as to why it's just taken for so long? You don't even know this exists. Most people don't have a clue this even exists.
So naltrexone, as I understand it, was sort of discovered as a formulation in the 60s. The FDA paper to get it approved for alcohol use disorder was written in 1994 by one of our advisors, Dr. Volpicelli. And so that that 30-year anniversary passed just 6 months ago. So it's been FDA approved for 30 years, even though it's been around longer than that. I think one of the major reasons it's less well known is by the time that FDA paper was written, the lifespan of its patent was coming to an end. And so nobody in big pharma has ever had much of a financial incentive to talk about it for that use case because it was almost immediately a generic. Um,
Interesting.
the
Very
brand name was Revere. Naltrexone is the generic.
got it. Got it. So let's talk about more the unique challenges you have creating a telehealth brand for alcohol disorder. Is there, um, with Aura specifically?
Yeah, so I think the stigma is a huge one. It is, as I say, the subject matter of alcohol use disorder is an uncomfortable topic for many. The fact that they would seek treatment through medication is uncomfortable for many and unheard of. As you say, very few people have heard of it. Data was just released that now 2.5% of people with AUD use medication to treat this disorder. Sounds like a small number. It was sub 2% a year ago. So, from a small base, it's growing quickly. And I'd like to believe us and our marketing efforts have contributed to that growth. So yeah, I think lack of knowledge, the stigma, and and in some cases, uh, folks outside of the medication assisted route throwing stones or being naysayers is a contributing factor. So, um, through in several marketing channels, we have had pushback from typically long-standing members of the AA community accusing us of all kinds of things. I have a few quotes here. Um, Oh, how many people did you kill today that watched your commercial? That was an email my founder got after our most recent ad started airing in June. Shame on you for selling a scam pill like this. So we've had that feedback on LinkedIn, on TikTok, in response to TV ads. So there's a lot of folks who are not comfortable with the idea of medication assisted treatment. And I think that still goes back to that myth I mentioned before that for some people, there is one way and one way only to solve this problem, and it is their way, and no other path is valid or should even be considered.
Yeah, I feel like, and we certainly work with providers in the addiction community, and I feel like the I'm not expert at this. I'm not a clinician, but what I'm seeing is it feels like, at least from the conversations I'm seeing, is a more balanced approach is beginning to emerge where because it kind of does become like a religion. And so there's very strong viewpoints on this, but from a marketing point of view, there's certainly opportunity here for sure. So let's talk about the the unique challenges. We've talked about some of the categories, like you mentioned, hearing loss, hair loss, weight loss, and these other things. Let's talk about um, your approach because you're really pioneering in a way. You've just mentioned some of these some of these quotes you guys have had. What is uniquely important in a field like yours when you're thinking about dealing with the stigmatized, without sharing all of your confidential ideas, but like, what are some of your secrets to success?
Yeah, I think what I've learned from dealing with stigmatized conditions is unlike traditional marketing where you sort of set up the problem and then you talk about the features and the benefits, um, typically skipping over the problem or only touching on it as lightly as you can is worthwhile. Sometimes, if you dwell too much on the problem, people can be offended, take offense. So, um, I remember running ads for hearing tests and people were livid on, in the comments on Facebook. Ads for erectile dysfunction and premature ejaculation can feel like an attack. Wait, why am I being served this? What do you think? So we focus the language on the solution. So don't talk about premature ejaculation, talk about lasting 4 times longer. We touch on alcohol use disorder only very lightly, and we try to talk more about the benefits of you can drink less or you can quit, you'll have less cravings, and hey, here are all the benefits of doing so over, say, a 6 month period. So, well, as soon as you start focusing on those positives, those positive emotions, rather than dwelling in the negativity, people are so much more open to hearing the message. So that's a major learning. Um, and then the other is just trying to be as trusted and as transparent as possible. It really helps us that our founder has basically been down this path. He struggled with his drinking for 15 years, and it took him 7 or 8 to even figure out where to even find help. He tried everything, and they not, very few things in life work for everybody. He tried several different paths to get help, and they didn't work for him. So his story, as sort of like a patient zero for us, is that origin patient is really valuable. It's not an uncommon situation like when at Roman Z would talk about his need for erectile dysfunction medication. So that's a big thing that people lean on and go, okay, you get it because you've been down that path.
Yeah, I think that authenticity was, yeah, the founder talking about his erectile dysfunction is such a disarming thing, right? It's like that is the taboo of taboos. I remember I'm old enough to remember when a presidential candidate, Bob Dole, came out when Viagra was first beginning to happen, and admitting he had rectal dysfunction. And I almost fell out of my chair. Like, wow, that is something that back then people just didn't talk about. And by the way, we've covered before sensitive healthcare topics before on our blog on a fair number of occasions. And one of the blogs was inspired by my wife telling me that she told her trainer, he said, "What do you want her to help me? What do you want me to help you with?" She said, "Menopause." And like that word was not even used. We've come a long way, baby. And the now through legitimate, I subscribe to Wired magazine, and once in a while they'll send vibrators as a ad. Like what? Things have changed a lot over the years, for sure. That's not something you would have seen 10 years ago. Well, let's drill down on the erectile dysfunction since you brought that up. The even the words like the idea of saying you've got erectile dysfunction, which is, a euphemism for impotence, even that's tough. And then you get into some complicated things like, because low T can be part of that, but they're separate things. So like, what have you found, having worked on that category as well, like just explain like sort of the messaging there and how that could be different and how that might work. I think that's interesting.
Yeah, I mean the language is so critical. The folks behind erectile dysfunction drugs in the first place went out of their way to create that new category, bending over backwards so that they could say something like ED and not impotence, because that word is unbelievably loaded. If you went back 500 years and walking around Shakespeare in England, being impotent, having hair loss, these were insults that men were facing at that time. So they come with so much unbelievable baggage. Low T is a new term. It is scientific. There's no playground insinuations associated with it. So when I was at Roman, say we were trying to do get a podcast host to talk about these things, the awkwardness when it came to ED was very, very palpable. I remember we did there was a read that we had with Conan O'Brien, and he spent more of the 60 seconds talking about how the fact that he didn't have ED than he did about actually the solution to it. Um, Hair loss wasn't quite as stigmatized, but it was definitely on the category. But then when it came to testosterone, guys were falling over themselves. They were like, "Oh yeah, I would love to talk about that. It's so interesting." Because for them, it was science, not stigma. And that's why when it comes to marketing and stigmatized conditions, it's so interesting because stigma is all up here. It's all perception. So it's totally in the realms of marketing, um, and how we can change that perception. Hearing aids are another one. The fear and anguish that those cause is really hard to put into words. The average person puts off dealing with hearing loss for 7 years. It is an unbelievably big problem that so few people want to tackle. And there's something deep within us that says that's a no-no. So all of these things are challenges, and yeah, anything we can do to overcome them, changing the language, changing the emphasis, and then subtler things about who you show in the ads. For an ED ad, so let's say the average age is like 45, 50, you'd want to show someone a little younger and like virile to say, and that's why there was in Viagra ads, they always had like retired athletes because I really, really wanted to like shift that emphasis.
Yeah, I think it's really interesting too, having watched low T become a thing. When I first saw pharma commercials for that category, and little did I know we would end up helping build the largest testosterone chain, or well, we bought one of the brands, and they bought their biggest competitor and became the largest testosterone business in the country. And so we worked with them for years, and it was interesting how, and that was clinic based more than telehealth based. But they would literally have fire trucks pull up where the guys would get off on their way, on their way back
Yeah,
from
yeah.
whatever. It's like, wow, that has changed, baby. That's a change. You wouldn't have seen that years ago. And so the reaction to these different categories sometimes is surprising. I was surprised how relatively easy low T took off versus some other categories. But it's not something that implies there's a problem with you, and it's a medical thing. So I guess I can kind of see that. Um,
100%. It's all about moving the fault from the patient away from the patient. It's not you, it's your low T.
yeah.
Before, again, because it comes down to the baggage. If you had erectile dysfunction, the old word impotence, that was deemed to be your fault, you were to blame. Whereas with low T, oh, this is like it's like if your lipid levels were up. That's not you. That's like a part of your body that is distinct or abstract for you. So by removing the blame, you remove the stigma, and so people were thrilled to deal with it.
Yeah, and I think that the difference too is, when they do talk about it, they're excited, right? So it makes it
Yeah,
just a lot easier. And that's why you have fire trucks with guys coming.
I can believe it. I can.
Yeah, that just blew my mind when we found out about that. It's like, well, it's working, you guys. That we have fire trucks stopping by. Like, well, I guess that means our marketing is working. That's cool. And it also had, and sometimes these today in our social media world, some of these things are easier to get going than they're not. And I want to go back to something you said earlier with the Everprint today, the algorithm has changed so much with Google, where it's now favoring AI overviews like half the time, many times, and people are seeing their traffics rocket down. And then ChatGPT, Perplexity, those are tiny by market share, but rocketing. I mean, there's incredible speed in terms of adoption rate growth. So the world of search is something that we do at a enterprise level every day. And we talk about this like almost every hour, like what to do. And the reason why that's relevant to this conversation is when you're looking at the SEO side or the dealing with LLMs, the large language models, the ratings matter a lot. They've always mattered, but now they really, really matter, reviews and
Mm.
ratings. And so, when you have such a touchy subject, I'm guessing that could be a challenge for you guys, where you have people that just viscerally hate you guys. And how do you manage that? How do you try to work and get reviews? Because even if even if they're not a customer, they may find you and go put up a rating on Google or wherever. And that's actually a whole different issue. You don't have the Google locations when you're doing telehealth. But how has that been? Any secrets to the review process and ethically making sure you can address these things beyond just saying we don't agree. Like, is there any secret sauce there?
So I think the first element about doing a better job of showing up in AI, the focus is definitely the last 6 months, we've had a real focus on trying to get more reviews from folks because we know that that's a massive way to feed the engine. And we've basically had, we went from all very few reviews to sort of, a really solid amount. And it's definitely now feeding into the AI engines. Um, I think one of the good things about alcohol use disorder is when people have come out the other side and they are starting to do better, it's extremely tangible. Like the effect on their life is remarkable. Like they lose weight, they suddenly have better relationships with their friends, family, partner. They're doing better at work, more energy, more focus, and they are so thrilled and happy to talk about it. And so actually getting people to say positive things hasn't been as big of a challenge as some of the other stigmatized categories. Um, I think it's just one of those nuances of the conditions. But like, if someone was to say to you, "Oh, I'm a former alcoholic. I've been sober for 10 years," that's something that they're gonna be proud of, and they're gonna, really tout it. So we've been lucky that so many of our members have been so kind with the time it takes to write reviews. At the moment, we get like, I don't know, three or four a day. And yeah, the lion's share. I mean, we're rated number one on Trustpilot in our category, and it's because our members have been so generous.
That's wonderful. Yeah, it's interesting because the it's so funny how some things as we're talking about this reminds me how things some of these things are new, but they're also timeless. So like,
Sure.
it's 20 years ago or more, Kathy Gordon, who works with me, and I were out teaching marketing at seminars around the country. And we used to talk about, you mentioned hearing aids and the stigma we would have hearing care practices back in those days. And, completely in the canal hearing aids. And how do you market that? And then the other thing that you just mentioned there, I used to do a chart about, I call it the happy factor. It's like when they first come to you, they're like, but then all of a sudden they're really excited. That's a peak moment. And that's when you want to try to get them to refer or give you a review. And then after that, they're still happy. They kind of forget. But for you guys, that peak is probably really high, where, because that is life changing, right? Like you suddenly feel control. And I can see how that aspect of your life could be so life changing. That's really exciting. And so they're probably really emotional. And there's a lot more to, of course, to the SEO. Well, actually, let me ask you another part of it. So one of the big things now is authority with the new algorithms. And so that, again, these things have always been important, but the relative importance is huge now.
Hmm.
Do are you guys working toward authority in addition to the review side? Is that something that you guys are finding is important for your category?
Yeah, the last couple of months, we've also pivoted to a much stronger investment, time, money, energy into PR. So we hired a great PR agency that came highly recommended. We're grateful that we have a great set of medical advisors, so they're able to talk to journalists with a great amount of authority. Our founder, as I said, Jonathan's got a really powerful, amazing story. And so we're gaining traction there. And so that's definitely the goal is you show up in the Washington Post, the Wall Street Journal, the New York Times, Bloomberg, the LLMs are going to say, oh, these guys are legit. It's going to take the same signals that a person would, but at scale.
Very good. So let's talk about how does Oar build trust with its members? We're going to pivot back more to where we were. What are some of the trust building mechanisms that you guys do?
Yeah, so I think super, super big emphasis on transparency. What we do, what we offer, the limitations, um, those are really key. So I think it's pretty much proven that people believe you more when you are honest and talk about your shortcomings and that you don't promise the world. We really do lean on our founder's story a lot because I mean, it's just the truth. If he hadn't gone through this process, the business would not exist. So we try to put that sort of front and center. So and our head coach and everybody who does the coaching, they have either taken the medication or are still taking the medication. So there's a lot of empathy that we can offer. And then from a clinical point of view, the physicians who advise us are experts in their field. As I said, Dr. V literally wrote the paper. He wrote the FDA paper. So, we're lucky that between um, our expertise and our empathy, those are two big, pillars that we can lean on. And then I think, showing up in Trustpilot as number one, having served the most patients of anybody in our category, size and feedback from members, all the things that signal trust.
Yeah, for sure. So, outstanding. Very rich topic. This is great. What are the KPIs that matter to you and your team the most? Like, what are you guys focused on? Because that's important to know as you're into this kind of healthcare category, but a little bit different. So, curious
Yeah.
the things that you guys are tracking.
The thing I'm working on right now that is most key in my mind is retention at the 3 month mark. So, um, is someone has someone managed to get to 3 months? Have they taken them? Have they received the medication? Have they taken the medication? Have they had any side effects? If so, have we dealt with it? Um, is there any change to the medication we need to make? And then are they meeting their goals? And if you get all those things right, if you basically you give someone the experience that they came to you for and they start winning, then they're usually pretty sold and they're like, oh my God, like this is the win I was looking for. And if you can keep them by that point, your chances of keeping them long term as a customer, as a member are strong. And then on the other side is just did we help this person? Like we're in the business of helping people, and as a healthcare company, if you're not helping people, you're not going to be in business for very long. So happily, what's helps us and is good to help them. So that's probably like my most important KPI at this moment.
That's interesting. And so one well question I have on that note, it's pretty famous. People that have depression, for example, they start feeling better. Oh, I don't need the meds anymore. Do you guys face that as an issue too? I mean, even if it like you have to, I'm assuming there's kind of a bumpy road getting them there. Once they're there, is there also kind of like they think, oh, no, I solved that problem. Now I can just move forward.
It is something it's pretty important for us. We try to address it by saying, hey, look, the clinical guidelines are you should be on this medication for a year. That's the moment where you readdress. I think in general, there's a sort of most people don't like to take medication that they perceive they don't need, which makes sense. And so there are a lot of people who say, I'm good. What's curious or perhaps important in this aspect is we get quite a lot of returning members which I
Yeah.
think speaks to the fact that people think they're in good shape and then they cycle off, and then in many cases, or at least in some cases, the problem returns. I know from talking to Jonathan, he's been taking the medication now for 8 years. He himself tried to cycle off on several occasions and found that, oh boy, it comes back. And so, I'm gonna stay on this. I think a lot of people find it very uncomfortable to think about any medication that you're on potentially, long term. Um, but that's true for GLP-1s, right? People are like, well, what happens when you come off it? But of course, if you had a heart condition and you need to be on medication for that, you wouldn't worry that you were on it. You'd be like, this is just the medication I need. So there's quite a lot of, there is some stigma right there of like, oh, you can take medication, but by definition, it must be short term, and anything that's long term has stigma. So there's quite a lot of things to unpack, and you're right, that is an element that's important.
So it's interesting you just said that though, because I got to tell you my own story again. I'm just like I can't resist. It's my podcast. I'll do what I want. You Um, so I've been in pretty good shape my whole life, like sometimes better than others. And I just got through losing about 8 pounds because like I work out way too hard to look like I do. So I'm back in pretty good shape here. But recently, for I was like noticing the my blood pressure was higher than it ever been. I never had high blood pressure, and I talked to my doctor, and she's like, "Well, it's like it could be just because you've I forget what she would called it, but there's like if you're pushing your heart so hard that uh,
Mm.
it's like you could have this." And I'm like, or it could just be, "Are you under stress?" I'm like, "Stress? Me? Maybe a little." CEO of a company. So she convinced me, and I'm like, that was what you'd even so, like, even with blood pressure medicine, I'm like, I don't want to take something forever. She's like, you don't take it forever. Just take it for now. We'll readdress it later. Like, okay, I can do that. But I wanted to fight because it's my identity. Like, I'm healthy, I'm in shape. I don't want to take blood pressure medicine, and I'm not going to take it forever. So, in a little bit different way, but it's still there. So, if you take heart, even when it's blood pressure medicine, it's like, I don't take that forever. And I haven't gone back to readdress this yet, but it's like I can see how people really push back on that. It's like in the GLP-1 thing too. It's like having observing this personally with my wife's her journey right now, people go immediately to like, you have to take it forever. And there's all these stigmas, like, the one thing that we talk about a lot, we laugh, is the whole Ozempic face, Ozempic butt. And that's rapid weight loss. It's not tied to Ozempic specifically. It's just these people lost
Yeah,
so much weight
yeah,
so fast. And so, like there's just so much in our world has always been misinformation. There's to be even more right now. But there's definitely these is very emotional things, this world you're playing in.
definitely.
Um,
Definitely.
I don't know if you have any other comments on that, but I just think it's interesting. Like people really, this is healthcare. They have like they're emotionally involved, and you've got to be really careful how you message. So you mentioned our when we talked before about the internal culture, and you guys are changing the world out there. How do you develop a culture where it's, people are willing to do that? And by the way, some people in any organization be more open to change than not. You put five people together, there's going to be a big difference. So how do you guys do that within your internal processes?
Well, for us, it's relatively straightforward because we still pass the two pizza test. We're only, I don't know, 6 or 7 full-time employees. So when it comes to accountability, there's only one of you in the large SUV. There's only 7 of you in the large SUV, like
Yeah.
you know whose job it is. So everybody is rolling up their sleeves all the time and having to help each other out. So that's a huge factor. I think, it's commonly it would not be a surprise to me that if we were to grow in terms of the size of the team, we might feature some growing pains. That's a nice problem to have down the line. But right now, it's a close, super communicative team. I had my first founder when I moved into the startup world would drill into me the notion of over communicating. So through the magic of Slack, we can be over communicating all day, every day, and that keeps us pretty cohesive and generally speaking, the train stays on the tracks pretty smoothly.
So going that you guys are doing digital marketing, the cost of acquisition is always a key metric. What are some of the things you've found to help you keep that in check or to even lower it? Because that makes all the difference in the world in your business model, right? At some CAC, it makes sense to continue. At others, it's unprofitable. You can't do anything. So
You
how,
mentioned before KPIs. I didn't mention CAC, almost because it's for me, it's like, what do you eat? I drink water. It's like worrying about CAC is something I do morning, noon, and night. Um, I think our biggest wins with CAC have been understanding the micro, this is an obnoxious phrase, but the micro seasonality of the consumer or the member. Like they are much more likely to act in the morning than in the evening. They are much more likely to act on a Monday than later in the week, beginning of the month versus later in the month, and certainly the beginning of the year. And so what we try to do is um, we try to harvest interest throughout the day, week, month, but then we try to uh, respond to them through CRM channels in the moments where we think they're most likely to act. So for an example, a really pointed example, TV is one of our biggest channels. We were finding that only running ads in the morning was effective because we were sending people to the website. We changed the CTA where people now text into us, and that means that we can then remarket to them compliantly because remarketing and healthcare is, tricky if at all possible. Um, and so, yeah, we're able to talk to them Monday morning. There's a text that goes to them saying, hey, is now a good time to deal with it? Knowing that if they do have a problem with alcohol, they're probably going to have had a big weekend. And it's not just the weekends, it's any day after a major drinking event. So straight after the 4th of July, after Halloween. It's like clockwork. Something like there's been a big drinking occasion in America because our dashboard will be lighting up the next morning. So really understanding that sort of micro-temporal nature of their like intent has been crucial for us.
I love that. That's really good insights. So so we just talked about CAC. What would just be your North Star metric and the one that you're really most concerned with?
We're pretty bootstrapped, so hopefully my founder won't kill me. But I mean, frankly, managing cash is massive for us. So when is that check gonna clear? How are we doing today on cash? Um, that that's sort of like the your poor man's metric. Once you don't have to worry about cash, you get to worry about higher level
Yeah.
issues. So yeah, that's my North Star today. Right now we're really on a knife's edge as for profitability on a month-to-month basis. So after cash is profit.
Yeah, that's great. And I can totally see that again with going back to cost per acquisition. That's like, it's like because the moment you start making it, oh, the algorithm changed. Oh, Google's charging 40% more. Like these are
Mm,
things that you can't control. And that's a challenge in the business because it either makes economic sense or it doesn't. So, but you're learning too at the same time and you're building a brand. So hopefully that'll get easier for you guys. I love what you guys are doing. The last question is, what do you think the biggest opportunities are for the next 12 to 18 months for Oar Health?
Uh, I would say a major opportunity for us is we're going to be launching only in a couple of weeks a fast acting compound. So it's a mint that you put under your tongue. It should reduce the efficacy time by 75%. So from an hour to about 15 minutes. Um, and also allows us to give somebody a lower dose. So um, probably we're hoping, but yet we'll have to yet to prove fewer side effects. Um, and so by having that point of distinction, no one, nobody else will be able to get. We're calling it clutch. You're the first person I'm telling this to. So
Fantastic.
yeah, so no one else is going to have clutch, and it will really help people, especially the ones who like to take their medication before they go to, say, a bar or a restaurant, either because they've decided not to drink or because they want to have one and not seven or eight. Um, so yeah, the faster it can act, the better. And I know from chats with my friends at Row when they launched a similar-ish product when they launched Sparks.
It sounded just like
Yeah,
Sparks. That's interesting.
major, yes, yeah.
Yeah.
I'm not embarrassed to say I borrow other people's playbooks for sure.
That's what makes you good. I love it. That's awesome. That is a really interesting insight. I've watched, this is my job, right? So I've watched what Roe does, and I thought that is amazing because it takes away the whole timing issue, or at least brings it down. It's like, oh, I can be more spontaneous. I can see why that would be, and it's a competitive differentiator.
Definitely.
Awesome. Well, I got to tell you, this has been a really fun podcast. And I love talking to smart marketers. It's the kind of stuff that's fun for me. It's why I do this, right? So it's been really, I've enjoyed this a lot. I feel like hopefully our listeners have listened intently. You've shared a lot of good insights. It is funny how, like, there's so much innovation here, and there's a lot of principles that are just there. You just found a different way to look at the principle that's been to make it really successful. I love the new idea where you guys are going. So, Neil, thank you. This has been fun. I hope you've had fun. I know I have.
Loved it. Loved it. Thanks so much, Stuart.